my name is Colleen Hughes and I'm going to be performing the shoulder evaluation. So first we're going to clear the cervical spine. Have you start facing me, back down. Does that alter or change your pain?
No.
And have you look over your right shoulder, and then to your left shoulder. Does that alter or change your pain?
No.
Bring your ear down to your shoulder, back to the other side. Does that alter or change your pain?
No.
And then I'm going to have you bring your chin down to your chest. And then back up. Does that alter or change your pain?
No.
Now we're going to do shoulder active range of motion, beginning with shoulder abduction. And bring your arms all the way up. Bring them down, checking for a painful arc. Next, gonna have them bring your arms forward and down. That was shoulder flexion. Now we're testing shoulder lateral rotation. Bring your arms here. Make sure they're tucked out as far as you can. And then internal rotation back in. And then lastly, we're going to have the patient put their hand behind their back, testing for a combination of internal rotation, extension, and adduction. And do on the other side as well. And then back. Next, we're going to do passive range of motion of the shoulder. So first, we're going to do passive shoulder flexion, passive shoulder abduction. And then while they're in this position, bend your elbow. We're going to do passive external and internal rotation. Internal rotation. And we're going to do both sides. Passive flexion, abduction. Once again, bend your elbow. And then external and internal rotation. And then next we're going to do isometric resistance of the shoulder. Just gonna stand here so you don't fall. This is shoulder abduction, so hold strong, don't let me move you. Shoulder adduction, hold strong, don't let me move you. Bring your arm up. External rotation, hold strong, don't let me move you. Internal rotation, hold strong, don't move you. And then we're going to do elbow flexion, hold strong, don't move you. And elbow extension, hold strong, don't move you. Perfect. And you would also test that bilaterally. And then next we're going to test for supraspinatus. So first we're going to once again go through the painful arc. See if there's any pain throughout the range of motion. And then we're going to do the Hawkins-Kennedy impingement test, which you flex and internally rotate the shoulder. And then we're doing the empty can test, which you put the athlete into scaption with their thumb down. And you hold your arm right there. Then you have them hold strong, don't move you. And then for the drop arm test, this is testing for a tear of one of the rotator cuff muscles. Have the athlete hold their arm up, and if there was a tear in the muscle, their arm would drop down slowly. Then have your patient put their arm behind the back. And you're going to palpate the supraspinatus tendon. Next, we are testing for infraspinatus. So we are once again going through the painful arc. Back down, and then we're doing the Hawkins-Kennedy test. Flex and internally rotate the shoulder again. And then we're doing isometric resistance of external rotation to test for infraspinatus. Hold strong, don't move you. And then lastly, I'm going to have you turn around. We're going to palpate infraspinatus by following the spine of the scap and dropping down. Back forward. Next, we are testing subscapularis, which once again you're going through the painful arc, but their pain will be anteriorly to the shoulder. And then next, we are going to do the Gerber lift-off test. You turn around again. Have your patient put their arm behind their back and lift your arm off your back, and then hold strong, don't move you, and then you can turn back around. We're going to do isometric resistance for internal rotation. Bend your elbow, hold strong, don't move you, and then lastly we're going to palpate the subscapularis tendon. Next we're going to do the long head of the biceps. First the Mears test, which is passive shoulder flexion with overpressure. You can palpate the biceps, and they would feel pain And then we're doing the speeds test, which you have the athlete resist shoulder flexion while the elbow is extended. So first, I'm just gonna put your arm here. Hold strong, really move you. In this position, hold strong, really move you. And then here, we're gonna have them slightly bent. Hold strong, really move you. And then next we're doing Yergeson's test, which we're going to resist elbow flexion and externally rotate the elbow. So hold strong, really move you while you're palpating the long head of the biceps. And then this is palpation of the long head of the biceps. And then next we are doing the labral lesion tests, which we have the O'Brien's test. The patient will have their arm flex, and then you wrap that tendon all the way around, hold that up, hold strong, really move you. And then you would also have the patient supinate their hand, and this would relieve pain. Hold strong, really move you. Bring it back down. While we are standing, we can do the anterior slide test. So you can have your patient put their hands on their hips, and you're going to apply a pressure forward and upwards. So hold strong, really move you. Bring that down. And then next, we're going to do the compression rotation grind test. So we're going to have you lay down. Have the patient's shoulder off the table, bend your elbow, and you're going to apply a pressure inwards and then internally and externally rotate. Internally, externally rotate. And then while we're here, we're going to do the jerk test. So once again, you're going to apply a pressure inwards and passively abduct the arm, and then a posterior pressure as you go through the range of motion. Next, you can stand up for me. We're going to do the glenohumeral instability test. So we're going to do the sulcus sign first. You want to put your hand around the humeral head and pull downwards on the arm, feeling for any instability. That test is a global instability test. And then we are going to do the anterior apprehension, relocation test, and the anterior release. So we're going to have you lay on your back again. For the anterior apprehension test, you passively externally rotate the shoulder as far as it can. And then next, for the relocation test, you apply a posterior pressure or a posterior force to the humerus, and then it should go farther. And then the anterior release, you release this anteriorly, and then the shoulder would sublux. And then the last glenohumeral instability test is the posterior apprehension test, which we're going to flex the athlete's shoulder to 90 degrees and then apply a posterior force to the humerus, and you may feel it clicking. And then we're going to have you stand up, and we're going to do the acromioclavicular joint test, which is your opposite hand, opposite shoulder, have it level. And this should reproduce pain in the arm that is moving. And we're going to bring it down and have you face this way, and we're going to palpate the AC joint. Thank you.